Good morning. I'm Andrew Lansley and I'm Strategic Counsel at Lowe Associates, who have the privilege and pleasure to support our colleagues at DG REGIO and the Border Focal Point Network. And I will have the privilege of moderating our discussion this morning, which is the 17th Beyond Borders Breakfast debate on the key subject of facilitating access to healthcare in cross-border regions. Welcome to all of you who are joining and participating in this discussion this morning. A key part of our debates is that we have opportunities for all of the participants to express their views. Could I remind you that the chat function is available in particular if you wish to put questions to our speakers and panelists, and we have an exceptionally fine group of speakers and panelists for this subject today. In addition, we seek the views of you, the participants, on this issue by the means of two polls, the first of which I will launch now. The first poll is to ask which of the following, and I have 6 options, has the biggest impact on facilitating patients' access to cross-border healthcare. You can choose up to 2, and the options are enhancing citizens' awareness of healthcare services across borders through the cross-border contact points. Secondly, establishing regional cross-border emergency response measures, such as ambulance crossings. Thirdly, expanding digital cross-border healthcare services with access to prescriptions and health records. Fourthly, initiating EU-wide standardized training for healthcare professionals. Fifthly, integrating health insurance policies across the European Union for equitable access. And sixthly, you can offer an additional reason how you think, what you think would have an impact on facilitating patients' access. And if you were to specify that in the chat, that would be really helpful. So let us commence our debate with an introduction, and I'm very glad to be able to introduce Valeria Cenacchi, who is from DG REGIO. Valeria, would you introduce our debate today, please?
Thank you very much, Andrew. I'm really glad that the Border Breakfast addresses this topic today, not only because I work on that, but also because back in 2018, one of the first action that the Border Focal Point Network was organized was precisely a big conference and a big study as well. At the time, REGIO and SANTE together, and a lot happened since then, including the pandemic. That was certainly an eye-opening, exceptional event. So the topic as itself has been growing both in terms of visibility, achievement over the different programming period. Just to mention a few figures, we have in our database, let's say, Keep EU, we have 1,300 projects in cross-border healthcare that are invented. And now in the current 21-27 programming period, 500 million is invested on the specific objective for better access to healthcare. And this is just to mention what, let's say, stems from the Interreg award, which is not the only support, but a big one for cross-border healthcare. As regard of the activity, the type of activity that are developed across Europe, the range as well that we know now is very large, from infrastructure, staff training, research and innovation, knowledge sharing, a lot of digitalization, more and more, let's say, prevention, inclusion. So my point is that on the why doing that and on the what, there is a certain general consensus now that exists on the EU added value of cross-border cooperation for healthcare in border region. It is recognized, it is promoted as well in the treaty itself, because it saves lives in case of emergency, for example, but it's also allowed to optimize the resources in the single market perspective. And we know as well that the quality of healthcare strongly contributes to the overall attractiveness of a region. So health is a priority itself. Cross-border healthcare is more and more an evidence. What it becomes more difficult, a bit tricky, is on the how. how to facilitate access to cross-border healthcare in the daily life of citizens, how to address the complexity that is inherent to the sector, that is at the crossroad of social, economic, cultural, environmental as well, policies and concern that involves both public and private decision makers, that is regulated at different levels of governance, from the EU to national to regional and local. So how to address the systemic barrier to cooperation, how to build as well the mutual trust that is always needed, but it is particularly needed when human health is at stake. So that is where as well we need incentives, we need innovation and creativity, we need a lot of goodwill. This is something that always comes out of every kind of experience in relation to cross-border healthcare, and we need practical experience that pave the way and inspire us for shaping better policy. So voila, that's the main reason for gathering together today on this, and the floor is to our super interesting speaker. Thank you.
Thank you very much, Valeria, for that excellent introduction. And let's move straight, if I may, to Marco Di Donato, who is a project and policy officer at EU-REGIO. That is the European Reference Network for regional and local health authorities. So, Marco, please, can you take us forward in terms of how the cross-border access to healthcare is being facilitated?
Yeah, thank you very much, Andrew. And first of all, I would like to thank the European Commission and the team from the Border Focal Point Network for organizing and facilitating this debate, and of course for having me. My name is Marco Di Donato. I work as a policy and project officer at EURIGA, the European Regional Local Health Authorities Reference Network. And as EURIGA, cross-border cooperation in healthcare is really one of our key priorities. So I'm very happy today to bring our vision and especially to present the way we work with our regions, with our members on the topic. But before diving into the cross-border dimension itself, if I can have the next slide, I would like to spend a couple of words on EURIGA. Basically, EURIGA is a Brussels-based no-profit association officially established in 2012, even though the network was active informally even before the date. And as suggested by the name, our members are regional and local authorities, operational, especially in the field of health. We all know here the importance of regions when it comes to delivery of healthcare services and implementation of health policies and public health policies. So I won't bother you with that, but yeah, at the moment our network counts 20 members, and 17 of them are regions in the full sense, as you can see from the map, and many of them actually are cross-border regions, while we have also 3 associated members that are not regions themselves, but they are networks or institutions that work closely with regions, especially on the cross-border dimension. As EURIGA, we don't have a disease-specific focus, let's say, so we cover a lot of thematic areas and domains in health, but we have some key priorities on which we work systematically and structurally with our members through working groups. And one of these is on indeed cross-border healthcare, which I will speak about in a few seconds. But another thing that I think it's worth mentioning here is that we as EURIGA, we run the Secretariat of the Interregional Group on Health and Wellbeing at the European Committee of the Regions, which gives us further opportunities for exchange and discussion on health topics with regional representatives and policymakers, and also on the cross-border healthcare. If I can have the next slides, I will just briefly explain you how we work with our regions. So as I mentioned, we have a working group on cross-border healthcare that we see as a place for our members, and you can see here some of them, the most active one, but of course it's not limited to them, of course. Where we try to, well, basically gather their expertise, and we have a twofold aim, let's say. on one side, we would like to facilitate knowledge and best practices exchange between members, and this is a key priority for us. It's crucial. We all know that, for example, also one-size-fits-all approach cannot be pursued in when it comes to regions, because they differ a lot. So what we try to do by sharing practices is to find common barriers, find similarities, and see how to learn from each other and strengthen cooperation. And on the second hand, we try to improve members' advocacy, policy, and project actions at EU level. As REGIO, we pose ourselves as facilitators, let's say, so we'd like to provide additional tools to our members to strengthen cross-border cooperation between them, touching upon two different sides. So we have the policy side, where we try to, besides the mapping and monitoring of what's happening at regional level, what are the best practices, and what are also the EU policy files that directly impact the regional dimension. We try to facilitate the connection with the European institution and relevant stakeholders in the field to get their input, and feedback, and try to establish a connection. And then on the project side, we have we try to help our members, support our members in project shaping, project design, implementation when it comes to topics such as cross-border cooperation. Of course, all of this is aimed on strengthening cross-border cooperation and capacity for action of regions at cross-border level, in cross-border settings, and in the end have an impact directly on EU citizens. And if I can have the next slide, I will just briefly explain you in a snapshot what are the topics under discussion and under our spotlight in our working group at the moment. So as you can see, and I'm happy to see that also some of these points were already included in the question at the beginning of the debate. Well, basically, we try to discuss together with our members what could be the barriers to access for citizens in border areas, and so we try to have a look to different thematic priorities. Let's say at the moment, of course, we have the legal obstacles, which is one of our main focus, and also with the spotlight, especially on the cross-border emergency services. But then, of course, we are always in mind the implementation of the directive and how we can improve members' capacity of implementing the follow-up actions to better implement the directive itself. But we have also an eye on public health and especially environmental health with our members. We try to look at barriers such as also communication with citizens and policy makers that sometimes, is a very huge obstacle when it comes to access to healthcare services across borders. But we look also into citizens' engagement and empowerment and many other topics. So I'm also just giving here a list of the best practices that we are currently discussing within our working group, and for sure you might know some of them, and I'm also happy to see that some colleagues and members from our network are participating in the debate. So I just want maybe to put the spotlight on a couple of them, just to bring also some different geographical aspects of the members of EUREGIO. So, for example, we recently discussed with our members the Access project that is currently implemented by Cenacchi, which is a network that promotes cross-border cooperation in the area of Hungary, Slovakia, and Czech Republic. So Central Eastern Europe, that looks into how to overcome obstacles, legal obstacles, to guarantee better access to citizens. But we also work a lot with Health Across Lower Austria and maybe a couple of best practices from their side to deepen also maybe after this debate. For example, the Gmund Cross-Border Healthcare Center, which was inaugurated in 2021, and that provides services both for prevention and inpatient treatment to people living in the cross-border area between Lower Austria and South Bohemia in Czech Republic, but also, for example, the and this is, I think, very symbolic and powerful example, this Bridges for Birth project that provides services on newborn children care, and we have examples of also of newborn child and birth from, for example, Slovakian mothers in the Austrian territory of Lower Austria, and that's quite very powerful example, I think, when it comes to integration and access to care from the very beginning, let's say, of our life. But then I would like also to mention, for example, the project carried out by ePrevent on active citizenship participation. We try to bring the citizens in the policy making settings in cross-border regions. So these are just few examples. Of course, some as outcomes of our work, we usually also publish publications, such as you can see. I put some links. Our response to public consultation, the position paper on healthcare in cross-border regions, and many others. But before closing, just a very few words on, and if you can go to the next slide, I would like to leave you with a message. And if I may have one click more from the colleague. We recently published in December 2023 our manifesto, and as you can see here, cross-border healthcare is really one of our key recommendations, and our aim is to put it at the center of the European agenda. How to do that? Of course, focusing on a better implementation of the cross-border Patients' Rights Directive, and we would encourage the European Commission, European institutions and stakeholders to work closely with regions on the follow-up actions to better implement it, and then try to look beyond the simple provision of healthcare in cross-border regions, but try to also have a look into the public health dimension, the environmental health dimension, and in other domains such as crisis response, etc. So I will leave you with this message and leave the floor again to Andrew. But of course, happy to answer any questions and connect with you even afterwards online. So thank you very much.
Thank you very much, Marco. Thank you very much indeed. And thanks for that excellent discussion of some of the policy and projects that you've been engaged in. And thanks for the access too. Just to remind everybody that the link that Marco was referring to is available on the chat. And there's clearly a lot of information about projects that illustrate some of the best practice examples and how the issues have been able to be dealt with in some of the areas that you're working with. I can come back now to the results of the first poll, which I think will be able to be shown on your screens. Clearly, you can see that the largest number of respondents thought that integrating health insurance policies across the European Union was the most important in having an impact on facilitating access. 3 others had a similar number of respondents, that is, enhancing citizens' awareness, expanding digital cross-border health services and access to records and prescriptions, and the regional cross-border emergency response measures. But quite clearly, the access to health insurance policies stood out. Let's hear, before we continue with our panel discussion, let's hear from a testimonial from one of the cross-border areas where healthcare is being provided. That is at the Valga Hospital in Estonia, which is close to the Latvian border. And we have a video testimonial from Apo Oja, who is a manager at the Valga Hospital.
Hello, my name is Maarja Brause and I am the head doctor of Valga Hospital. Valga Twin City is a city on the border of Estonia and Latvia. And although the hospital is in the Estonian side, we have been providing services also to Latvian citizens, especially from Valga city. And in the future, we want to activate this cooperation even more. Last year, we made about 1,000 studies of ultrasound and X-ray to the people of Valga. In the future, we want to provide even more services because we have kind of a big hospital with different kinds of departments and different kinds of services and a lot of good specialists. So we could provide more services to Latvian people with the cooperation of Valga GPs.
We have opened up a brand new emergency room in Valga Hospital, and it would be nice if Valga people could get help in here instead of driving 50 kilometers all away to Valmiera Hospital.
In addition to X-ray and ultrasound studies, we could provide CT studies in the future for the Valga people in Valga Hospital.
In Valga Hospital, we also provide lighting rehabilitation services. And we also have a nice therapy pool, which is very popular among our patients. And why not provide those kind of services in the future also to the Valga and people from Latvia.
So right now we are in the city of Valga, in Estonian side. And right there across the border is Valga from Latvian side. It would be so logical and convenient for Latvian people to get their healthcare services here in Valga Hospital. And we are very interested in activating this collaboration and providing more services to the Valga people in the future.
Thank you very much. Well, it wasn't the manager, it was the doctor, so that's fine. But I'm sure the people of Valga would very much appreciate what it is that they're preparing for them in the Valga Hospital and the opportunity that that will give them. That's terrific testimonial there. Let's commence our panel discussion, but with a particular contribution first from Natalia Zampieri from DG SANTE. Natalia, you've seen the results of the first poll as well, and clearly you're engaged with all of those and all the issues relating to cross-border healthcare. Perhaps you could tell us something about how DG SANTE is addressing all these issues.
Good morning, everyone. Thank you, Andrew. First of all, I'd like to thank you very much for inviting me to participate in the 7th Beyond Borders Breakfast Debate series on facilitating access to healthcare in cross-border regions. And indeed, the results of the poll are very interesting, and I will explain you how DG SANTE is addressing one of these aspects, which is the aspect on the awareness of patients' rights. Next slide, please. So Directive 2011/24/EU on patients' rights in cross-border healthcare was evaluated in 2022. The main conclusions of the evaluation indicate that the cross-border healthcare directive remains relevant to the needs of the EU citizens to facilitate access to cross-border healthcare. However, there is a low level of awareness of patients' rights on cross-border healthcare, including the fact that there is a complex legal relationship between the cross-border healthcare directive and the Social Security coordination regulations. And this makes even more difficult for citizens to understand their rights and for the national contact points on cross-border healthcare and also healthcare insurers to explain it to the patients. Next slide, please. So in this context, the Commission is funding 10 workshops at national level, including joint workshops in border regions, with the aim of improving information to patients and by raising awareness of patients' rights and obligations in cross-border healthcare. and by raising awareness of the European reference networks on rare diseases. In addition, the objective is to better inform those stakeholders who might be potentially concerned by EU citizens' decision to seek healthcare abroad, such as healthcare professionals, healthcare providers, payers, national and local administration, patients' organization, etc. You are all invited to attend these workshops in person or remotely, and the link for registration will be disseminated by the national contact points before the events. I invite you to check the national contact points website for the concerned member state periodically. As you can see from the slide, for example, one of the workshops will be actually in the border region, Valga-Volga, in the border between Estonia and Latvia. We will have also another example of border region workshop. It's a joint workshop between Belgium and the Netherlands. It would be in the border region also. We still don't have a date, a fixed date, but it would be in autumn 2024. We also have an interesting joint workshop, which is between Cyprus and Greece. It will happen in June 2024, and this workshop will be held in Athens in June. Still a date to be confirmed, but this is also another example that we have on joint workshops. This is actually not a cross-border, let's say with the border, but it's in any case an example of a joint workshop. But I would like to just flag that our next workshop will be in Italy on 11th of April. So the registration it will be soon this week, if I'm not already online, the registration for this workshop, and of course you can also attend remotely and to follow this workshop. This workshop particularly will be held in Italian. So this will be the language of the workshop, usually actually as it's a national workshop, or at least a cross-border a border workshop, the national contact points they decided which language they will have this workshop. This one, the next one in Italy will be in Italian actually, but I would invite all of you to attend one of them if you are interested. Next slide, please. The Commission is preparing some updated dissemination materials, which will be tested during these workshops. And at the end of the project, at the end of these 10 workshops, the series of 10 national workshops, this material will be subject to revision. Our aim is to have concise and comprehensive dissemination materials translated in all EU languages, which could be used by the national contact points and other stakeholders to better inform patients about different topics. For example, which are the requirements and what are the administrative procedures to be followed when assessing cross-border healthcare via the directive or via the regulation, the Social Security regulations. And for example, what are the applicable rules on tariffs and reimbursements, which are also a very important topic when the cross-border healthcare comes into play. My next slide, so I'll close my presentation, my intervention right now, but we remain available if you have any question. If you eventually don't find the registration for one of these workshops, of course, not all registration are open now. They will be open more closely to the workshop. So, but in any case, we remain at your disposal if you have any question. Thank you very much.
Thank you very much, Natalia. That's really helpful, and I'm sure we will have questions in the course of our panel discussion. That's really useful, and thank you for the details of the workshops, which I'm sure many of our participants will themselves be hoping to participate. Can I launch our second poll? And then while our participants are expressing their views in the second poll, I will take introductory remarks from our other panelists. But let me just say the second poll is essentially to ask the question, what are the main barriers to accessing healthcare services? So we're focusing in on the barriers. And the options are limited data exchange, insurance coverage limitations, insufficient funding and resource allocation for cross-border healthcare initiatives, limited physical accessibility to healthcare facilities, and transferring of prescriptions and or preferential treatments. Preferential treatments essentially being patient-specific treatments in the main. So if our participants could vote in the second poll, and meanwhile we'll have the opportunity to hear from our distinguished panelists. Jessica, let me come to you now. Jessica Nouguier, you are working on the cross-border cooperation in the SaarMoselle region. Could you tell us something about how that is functioning and what that's telling you in terms of best practice, and maybe reflecting on some of those difficulties and how they're overcome?
Yep, of course. Thank you. First of all, thank you very much for the invitation, and I'm glad to have the opportunity to share our local experience and perspective in the region SaarMoselle. So my name is Jessica Nouguier, and I work as a project coordinator at the Eurodistrict SaarMoselle. So I would like to present in a few words what the Eurodistrict is. It is a German-French region at the heart of Europe, as you can see on the map, where local authorities from 6 French and German territorial authorities from Saarland, so in Germany, and Moselle in France, work together in a joint organization. So with its approximately 600,000 inhabitants, the Eurodistrict has a high population density and a high number of cross-border workers. And the structural problems on both sides of the border are quite similar due to the common shared industrial past in mining work. So, and compared to other border regions, there's not really a natural border such as a river separating the two countries. So it makes it even more of a common living area in which borders are not really taken into account. However, border-related obstacles are still very much present. So that's why the Eurodistrict was created in 2010 in the form of an European grouping of territorial cooperation that pursues the long-term objective to create a better common cross-border living environment. So we can move on to next slide. The objective as regards health is to improve cross-border access to health services for the citizens of the border region, especially regarding the growing shortage of medical staff and the aging population in Saarland and Moselle. And so there are already some best practices in the region, like, for example, the agreement on cooperation in the field of cardiology, which is also included in the Moselle agreement on cross-border access to healthcare services. So since 2013, and after several years of negotiating, the hospital in Forbach in France and the hospital in Völkling in Germany decided to pool their efforts and competences in order to contribute to improving cardiac care, especially in emergency care. So in case of an acute myocardial infarction, the patient from France can be transferred to the nearest hospital in Germany, which is specialized in cardiology, instead of being brought to the nearest hospital in France, which is in Metz, which represents 20 to even 30 minutes of time saving, and therefore better chances of survival. But it also promotes staff mobility and professional exchange. So the German staff is several times a week working in the French hospital and thus strengthening the medical staff there. And all of this enhances the resilience in times of crisis, because the staff know each other, they know the other system, they know the equipment in the other hospital, and also builds up trust and also friendships. And that, for example, allowed a faster and better reaction in COVID-19 times when the French hospitals were saturated and French patients were transferred to German hospitals nearby. We can move on to the next slide. Maybe a few words to the Interreg project, the European project EGTC SaarMoselle, that went from 2020 to 2022 and was funded by European funds. So this project was very important to create spaces for the exchange and work of medical professionals. So we installed several thematic task forces to create really a dynamic network of professionals. We also developed a sustainable and joint management of health policy by creating a sustainable and cross-border structure which can centralize all of the information and especially coordinate the cross-border healthcare cooperation. And it was also important for public outreach because we created also a healthcare contact point, especially for this region, SaarMoselle, where a citizen, but also institution can contact us, and we either transfer the questions to our partners who work in hospitals or who work in the health assurance company, or we also transfer information that already exists. And another focus point was the organization of the Healthcare Day SaarMoselle, which took place every year and was an event with around 200 participants from the region, but also from other European borders, to kind of have this exchange and also show some other best practices on some other European borders. So I think that was all for a little input on the activities on the Eurodistrict, and I'm glad to stay available for questions.
Thank you very much indeed. That was really interesting, and I will come back to you, if I may, in a moment when we get into the panel discussion, because I think there's some interesting questions prompted by that very informative explanation. Let me just, since we closed the poll, so we have the results of the second poll, which will enable us to feed that into the panel discussion. So main barriers. Now, like in the first poll, insurance coverage limitations and gaps in cross-border healthcare agreements is the single largest respondent's choice. We also have a number of others. So limited data exchange is an issue. The funding and resource allocation is an issue, transferring of prescriptions and so on, and a small number talking about the limited physical accessibility to healthcare. So with that in mind, let me turn to Caitríona Mullan, who is an independent specialist working with DG REGIO on issues including cross-border healthcare and public health initiatives. I wonder, Caitríona, if you could tell us something about how you are working on these cross-border healthcare issues, and maybe if you're able to pick up any response to some of those barriers that people are talking about and how you've seen those being able to be addressed, that would be really helpful. You're mute at the moment, Caitríona, I can't hear you.
My apologies, I was so intent on listening, I forgot to turn my mic on. Thank you, Andrew, and good morning, everyone. And first, a thanks to DG REGIO and colleagues at the Border Focal Point and in Interreg for inviting me to speak this morning. It's great to see so many colleagues, new and old, on the call this morning. I am working currently with DG Regio on the Interreg programs for Romania, Hungary, but that's very much in the context of the wider challenge in Central Eastern Europe around making health systems resilient, and resilient not just in the context of the pandemic, but also in a post-pandemic context. So that's one of the perspectives I'm bringing to this. As background, I should also say that I led the DG SANTE ABR patient mobility study, which was carried out actually during the pandemic and fed into the evaluation of the directive on the rights of patients in cross-border healthcare. And I also facilitate the objective 2 of the B Solutions initiative, which is delivered by the Association of European Border Regions. And of course, B Solutions has produced many case studies and is working on a number of different solutions to obstacles in cross-border health. We were actually in Valga last week within a workshop. I had the pleasure of meeting Maria, who you heard from earlier. She is the medical director of Valga Hospital. She means business. She's very interested in how the hospital can really meet the population health needs in the region. So I was delighted to see Valga being covered today. I think the context that we're having these conversations in is very important to just note, and that is that we are post-pandemic. During the pandemic, what we saw was a rebordering of Europe in terms of patient mobility and general mobility across borders. And then when it became apparent that closing borders wasn't actually going to stop the spread of the virus, we had a debordering. The overall effect of COVID with remote working has created this debordering phenomenon in Europe that we're still trying to understand. What we also learned from the pandemic is that health status matters. It matters for human survival because the higher your health status, the greater chance you have of surviving a pandemic. And secondly, it matters as an economic factor, and it matters now for Europe's economic recovery, and it matters now for European competitiveness in a global context and in the current geopolitical context that we are facing. So for cross-border health to be located in that is really important, because cross-border health covers, good cross-border health systems that facilitate resilience between member state health systems is vital for stability. The borders are the seams of Europe, and if the seams are strong, the fabric holds. And I think we have to remember that about health. So health has taken center stage in Europe, and as Marco said, it's hugely important that this remains at the center of the European debate as we go forward. In terms of what patients and citizens needs, the poll results don't surprise me at all. From having worked through the issues with mobility in a number of border regions on the DG SANTE study, yes, the health insurance fabric is very important. How insurers work with each other, but also work with border populations is very important. But I'm going to take this from the patient and the citizen's perspective. Essentially, patients and citizens need there to be systems in border regions that are capable of delivering patient rights under the directive and in terms of their entitlement under the regulation. That does mean work around tariffs. That doesn't just mean information on tariffs. It can also mean looking at the differentials between tariffs between countries, which may not all be cost related. They may actually be just due to baseline funding issues in member states. So there's a lot of issue there. Patients need smooth reimbursements if they are paying upfront for care under the directive, for example. So they also need not to have that administrative burden of accessing the resource for their care if member states can work in a different way. And I think that's the thing that you see, for example, at Valga Hospital. So there has been a block agreement for the provision of ultrasound and X-ray as a result of the B Solutions initiative initially. They're now looking at expanding that agreement, and we're hoping that the insurance funds and the ministries will see ways that that's going to add value and benefit everyone. So the issue of health systems looking at cross-border collaboration themselves as to making their own systems more efficient. I will mention the Cross-Border Cancer Centre at Derry in Northern Ireland, which is my home city, so I have to say this, but actually it's a very good example of where two systems came together, not using Interreg money. They came together, they commissioned a cross-border service, a shared service on an entire cross-border population catchment, which meant it was feasible, and it meant that each system only has to pay half of the value of that. So I think there are examples around of the shared services agenda in border regions. We must remember that 30% of the European Union population lives in a border region. This is not a minority sport when you look at the whole European Union. And then you look at the particular needs on external borders, particularly on our eastern border, for the kinds of services that are going to be needed. We're going to need to support trauma rehabilitation, looking at mental health. There's some very interesting stuff going on between Romania and Hungary around looking at trauma and rehabilitation systems on the basis of complementarity between what's available on either side of the border. So not duplicating each other, but joining together and being stronger as a result. Patients need proximity. So, and it's not just because the patient should be able to access care closer to home. Care closer to home in some cases is a patient safety issue, and it can be a matter of life and death. So if you don't get access to certain types of urgent care, for example, it's risky. You're at a higher risk. Maternity care is another example. So care closer to home is what patients in border regions need. They also need good exchange of patient data, because again, good patient data between clinicians it's a patient safety issue. Your clinician, the treating clinician, needs to know what your medical history is. We have sufficient data capacity, data management capacity and digitalization to start looking at these interoperability issues on borders. And, I think our understanding of GDPR is much more advanced than it was even 3-4 years ago. So there are ways of looking at this. Patients also need effective cross-border cooperation between the health systems. So this isn't just about the citizens being the activator for these systems. The removal of obstacles to mobility at system level, allowing for clinical leadership to lead the care development in border regions. Let clinicians do their absolute best. Let them look at those areas of excellence that they want to practice in because they are clinicians. For example, you heard Maria talking about working more closely between secondary care and GPs. The 9 principles of integrated care in border regions can actually lead to the best utilization of what are usually scarcer resources, but for example, over-reliance on family doctors. Let's strengthen and build the capacity of primary care systems to complement secondary care systems. We also need good data, not just patient data, but we need population health data. We need collaboration in border regions, not just between the health systems, but with local government, national authorities, so that we have good evidence for more innovative planning of collaboration between health systems in border regions. We need to integrate health data, population health data into cross-border regional spatial planning models. And if we do all of these things together around the patient, then we will be using to the best of our ability the resources that we do have, but we will also be, I think, and I hate the term sweating our assets because it just has connotations that I don't like, but the idea is that we will be optimizing the assets that we do have in patient care, and that will benefit whole economies, and it will benefit national economies, and it will make life easier for the health ministries in the member states to be able to do their job. That's all I have.
Thank you. You've taken us right across the whole horizon of cross-border healthcare initiatives. I do want to bring in our 5th panelist, Anne Dussap, who is working with the Tri-National Centre on Facilitating Access to Healthcare. Do you want to tell us a bit about that, Anne? Sorry, time is against us, so if you're able just to do a quick introduction, that would be very helpful.
Yeah. Thank you very much, and thank you very much for inviting me to speak today with the different panelists. I've heard with high attention, and I can just agree with what Caitríona just said before. So let me first introduce the TRISAN, Tri-National Centre of Competences of Cross-Border Cooperation in the Health Sector in the Upper Rhine region, meaning at the border between France, Germany, and Switzerland. You have the chart on the slide. After 2 Interreg projects, we are now a permanent project hosted by the Euro-Institut and supported by 25 partners, healthcare authorities, local and regional authorities, and the 4 Eurodistrict of the region, with the aim to develop potential of healthcare cooperation in the Upper Rhine region. Through knowledge production, support of project, and network building. And we are now focusing on 3 topics: patient mobility, shortage of skilled professionals, and prevention and promotion of health in the 3 countries. Maybe the next slide. After the pandemics, we've conducted 2 surveys to identify better the obstacles encountered by citizens with cross-border healthcare. And for us, it was also the possibility to know how many people are interested in healthcare services. So we first, and out of these 2 surveys, we, as a result, maybe also for us to hear, we have already like 20% people already crossing the border for healthcare services. But the interest to benefit from healthcare services is 43%. And for us, it was important to show also to stakeholders that the interest for healthcare services is still quite developed. And the main obstacle still encountered by citizens is the lack of information on healthcare services in the neighboring country, who is providing which kind of services, what kind of services is provided, because it's different from country to country, where and by whom. The second obstacle is the access on possibilities for reimbursement. You've mentioned the different EU instruments, but the implementation in the different countries is different. And within the different implementation of either the directive or the regulation, there appear new problems in benefiting or in using the possibility of cross-border treatments. I mentioned some of the obstacles which citizens encounter. A next obstacle is the necessity for prior authorization for some treatments, and of course it's not the same kind of treatments in France and Germany. I do not mention Switzerland, which is not part of the EU and which has not signed the directive, for example, in our region. Language barrier, but maybe not such as a problem as one could think first. And some specific problems for cross-border workers. Maybe the next slide. What we do concretely, we have been preparing different guides, either for patients or for commuters, where they can have information of how they can be reimbursed, what are the risks or possibility for higher costs of for their treatments. And beside of that, we made information campaigns on social media, and we are still running information workshops for citizens but also for practitioners to know how to organize the payment of patients from the neighboring country. And another kind of work we did is cartography of practitioners, so that people can have a look where to find a kind of a specific practitioner or a specialist. Maybe the next slide very quickly. Another field of our work is to work with the stakeholders. As I said, we are financed and co-financed by healthcare authorities. So our first counterpart or our first target group is the stakeholders and the healthcare authorities. And the main obstacle is, of course, the asymmetry of systems and the difficulty to identify the counterpart when it comes to set up a cross-border project. A next very important from our perspective obstacle is the different implementation of the DRG systems and the lack of transparency of the cost in the neighboring country, which brings to, or which has a consequence that there is a very high fear of the cost in the neighboring country, and which as a result is a resistance to support the development of cross-border projects. And last but not least, the lack of personal resources. To set up a cross-border project needs resources, definitely. What we are doing on that, it's written on the slide. I won't go much into details, the cartography, and identify complementarities. Try to see if we can and where we can design cross-border patient journeys, like Jessica mentioned, on the field of cardiology, for example, which would benefit for the citizens, but also at the end of the day, also for the health systems on the both sides of the border, because there is not need to invest much at 1 or 2 kilometers distance to do the same in parallel, so to say. So I will finish there, and I'm open for question.
Thank you very much, and thanks to all our panelists. I think we've got time for 2 or 3 questions which I've gathered in. Can I come back to you, Marco, first? You can see from the poll results how important the question of insurance coverage is, and I guess there's a number of things there. There's the coverage, there's tariffs, but there's also, as Anne was describing, prior authorization for treatments. I think amongst your members, you have a lot of those who are the commissioners, the payers for care. Are they getting together in order to try and reach agreements about more standardized coverage and maybe more general prior authorization for treatment?
Yeah, thanks, Andrew, for the question. Well, of course, our members, they are, of course, trying to see with their neighboring countries and regions how to address this kind of issue. Of course, I mean, in many regional settings, we still have like a upfront out-of-pocket payments from patients. So there might be negotiations on this, and we know that some of our members, for example, through also the project, Interact project, and for example in the Hungarian and Slovak and Czech Republic region, they are trying to see how also to overcome this kind of obstacles. And so yeah, this is something that we are trying to also address within our working group, to see how regions are working on this specific thing, which still is one of the main barriers when it comes to access. So yeah.
Thank you very much. Jessica, can I just come back to you, because you made reference to how since 2019, the Treaty of Aachen had enabled there to be enhanced cooperation. I mean, clearly we're dealing here with something which is covered by the Cross-Border Healthcare Directive, but is also in national competencies for the delivery of healthcare services. Is that an example of how a combination of EU legislation and national agreements can deliver the answer?
Yeah, I mean, it shows what opportunities there are, and since healthcare is still a national competence, national stakeholders should be also handling on this thematic, and so the Treaty of Aachen is also was very new, because it really put a focus on cross-border cooperation and organizations like the Eurodistrict, and gave them, or in the text, gave them some competences to give the possibility of derogating from national legislation, for example. So it could be offering a possibility to experiment some projects that are really located on the border regions, and because of the realities and different realities of border regions. So I think it's really important to have the support of both European level and national level, since that's one of the main obstacles that regional and local authorities and other actors in the field have none or only very limited competencies. So there are a lot of ideas or projects, but to really implement them is always depending on other levels.
Yeah, thank you, Jessica. Can I just draw people's attention in the chat? Sibyl from AIM is talking about how the Health Insurance Fund want to, she can say their members are working to find solutions to the obstacles, including the reimbursement of costs. I wonder, last question, if I may, Natalia, to you. You talked about the reference networks, and clearly there are some good examples we've heard of how people are working to access more specialized care and to access services for those with rare diseases, where sometimes one needs to access what's effectively a large population in order to get the necessary services delivered. Are the reference networks really a key part of this in terms of delivering more specialized services?
Thanks for the question, Andrew. Indeed, they are. But the concept of the national contact of the European reference networks is not that the patient goes to a different member state to have the treatment. Is actually the knowledge that goes across border, in a sense that the European reference networks, so there are 24, each one for a specific rare disease. And what happens is that there is a pool in one network for one specific rare disease. There is a pool of, there's a number of members that are from different member states. And these members, they can contact each other when they have a patient on their home hospital that that has a rare disease and needs treatment. So in this case, it's not the main concept. It's not that the patient goes cross-border, but it's the knowledge that it's cross-border between specialists.
That's very helpful, Natalia. Thank you very much. I fear time is against us, and people will have other responsibilities they must move on to. But Valeria, I wonder if I could ask you perhaps if there are any conclusions that you want to draw from the fascinating presentations that we've been hearing.
Yeah, honestly, I was amazed. I think it was very, very interesting for everybody to listen. My takeover would be, let's say that there are still a lot of things that we can do from now on. We when we go out of this meeting, and one thing certainly that is already possible is to improve the communication at all level, the communication with citizen to citizens, because this is really something that we can already do now. So, I think we need to be in the action, and also this communication and better understanding between systems. I think there is a lot still to be done in the mutual understanding in a border region, how it works in terms of how the cost is organized, how the health system is organized, how also the medical culture is different. So this is something that can already be done from now on. We have champions here, we have pioneers and people that are already very advanced and in terms of experience. So I think this learning and sharing the best practice and the learning is really something that we should go on this and organize also bilaterally things on that. And then there are also the other elements that are, let's say, not maybe can be done today, but from tomorrow on, it's really addressing the obstacles, the barrier that are still there. And we understand there are many. But from this learning, from this communication, from this sharing, it's also a way to move forward. And I think there are a lot of issues that can be solved starting from there. Voila.
Super. Valeria, thank you very much. And thank you to all of our panelists for their terrific presentations and for being very forthcoming with their responses to the points in the discussion and also on the chat. So I just want to remind all of our participants that there are many of the useful links on the chat, not least to the national contact points and to the material that supports the presentations we've been hearing. And just a quick Hello, and thank you very much to Dr. Browser from Valga Hospital, who tells us in new news from Valga Hospital that there's an agreement to provide CT studies in addition to those that we were hearing about on ultrasound and X-ray. So terrific. Thank you very much. Can I, before you all depart, tell you also, please, about this exciting recent initiative, Youth for Cooperation. Young people taking an opportunity to apply to be cross-border ambassadors as part of our border focal point network. It is designed for 18 to 30-year-olds living in a European Union member state or an EFTA country who are fluent in English and who want to participate in effectively all of the main activities of the cross-border focal point network, in the debates, in the discussions, and through the futurium and the like. So if you are or know of somebody who would like to apply, can you remind them that applications, please, have to be in by Friday, the 29th of March. So that is tomorrow week, Friday, the 29th of March. We'll be delighted to have our young people giving us ideas and initiatives for how cross-border cooperation can be further enhanced in the future. It's been an absolute privilege and pleasure to listen to all of those excellent presentations today. Thank you all very much for being with us. Hold on to the date, 16th of May, for the 18th cross-border breakfast debate, cross-border breakfast debate. I'm very much looking forward to it. I know you are. Thank you very much for being with us. Thanks once again to all of you, our participants, for joining us this morning. Have a very good day.